Right, do you want to gather in? And we'll talk about these two techniques first of all. Have you started yet? So these two techniques that we're going to do today, connective tissue massage and specific soft tissue mobilization. Neither of them are used frequently, but both have very individual and specific uses. So connective tissue massage is literally about trying to find thickened or scarred areas of fascia. So that's the connective tissue that we are particularly trying to target. So in finding where this area is, we need to determine which layer of tissue that the scarring or the fibrous tissue is found at. So when you're doing your initial effleurage and your stroking techniques, it may be that you can feel some sort of lumps and bumps as you're gliding across the surface of the skin, and you've got to determine, is that the skin, the underlying surface of the skin, is it the fascia below that, or is it muscle tissue below that? So there are ways of finding that out. First of all, if you're doing the stroking movements and you feel the lumps and bumps, first thing to do is to try and determine, is it the skin? And the easy way of doing that is to then hold the surface of the skin and move it around. Now, if you're still moving over lumps and bumps or some sort of dip or anything like that, any irregular sort of surfaces, then it's an indication that it is lower than the skin. If you're just stroking over the skin, then obviously you can be going over that sort of surface. And very often you'll feel that sort of corrugated effect or that sort of bubble wrap type feeling, and that's usually the skin surface. So if you're still moving over that sort of lumpy area or thickening or something that you can sense that's different there, now you've got to determine, is this on the surface of the muscle or is it deeper than that? And just some deep palpation and again some circular movements, moving the skin over that surface, will help you determine whether it's the fascia that's now moving around over the muscle tissue or whether it's a thickening of the muscle underneath that. And if you just push down into the muscle, certainly if it's scar tissue that runs through the thickness of that, you'll feel the density and you'll feel when you compress it how much resistance there is there. If it's in the muscle tissue, then what technique would you use that we've done very recently? Ideally, to stretch out a confined area of muscle? Yeah, your soft tissue release. Because there you're going to try and lock out part of the muscle and use a joint action to try and stretch just one section of the muscle to try and stretch it. If it's connective tissue and it's fascia and it's sitting on the surface of that, we've got other ways of targeting that. And what we're going to do is basically, having warmed up the area and done all your preparatory techniques, we'll return to that site, try and determine how big the mass is that you're working on, and then you're going to do some compressive techniques working from the centre of that mass outwards to the edges. So if we just imagine that you've done some palpation and you can find, let's say, an area like that on the back of Jordan's hamstrings, what I'm going to do is basically push into the middle of that mass and just push outwards with a simple technique like that. The problem straight away is that you're going to be restricted by the tension in the skin. So to facilitate a little bit further, or being able to move a little bit further with your fingertips, you're actually going to draw the skin towards the middle of that circle first of all. So I would normally do one hand reinforcing over the other like so, draw towards the centre, extend the fingertips so that you're now pushing down into the middle of that mass, and that gives you the pressure to just work outwards again. Okay? And you can see straight away that I can go that much further by drawing the skin in first. I've got the advantage here that I haven't put any oil on yet, just for demonstration purposes, and hopefully by the time you get to the stage of massage that you want to do this, you'll have minimal oil on the surface. If there's too much there, then a bit like STR, don't be frightened to take some of the oil off the surface that you can get better purchase. The idea will be that you're going to be compressing that connective tissue and stretching it outwards from the centre of that mass, squeezing the fluids out of that connective tissue and changing what we've described over and over again this year, the viscoelastic properties of it. So by warming it, changing that consistency, hopefully you're going to make it more pliable and therefore more functional around that particular muscle area. difficult part comes to when you do the near side. So for me, working in a circle, I can just move around like so. What happens when I get to this half of the circle? I'm either going to go around the other side and work from the opposite side of the couch, but just so that I can keep going around this particular circle, I'm going to use thumbs. And if I just sort of move my hands out of the way, I'm going to draw the skin towards the middle like so with my thumbs in that position, turn them like so, push down and push outwards again. So draw towards the middle, push down, push out. You comfortable with this, Jordan?
Yeah.
Yeah. I'm not pushing too hard at the moment. Okay. As for time that you'll work an area of tissue, it'll be up to you. It'll be entirely subjective according to the thickness of the tissue, how restrictive it is, and so on. And you're basically just trying to mobilise that area, make sure there are no excessive heat adhesions and so on. Okay? Any questions on that so far? Okay, we'll recap in a moment, but we'll move on to the other technique, specific soft tissue mobilisations, or SSTM. This technique is not commonly known, but I understand is used a lot by chartered physios. So physios tend to do minimal amount of massage during their courses, so they obviously put a lot of merit into this particular technique as being very valuable. It is solely used in relation to the healing process. So don't think about using it as a stretching technique or any other form of manual therapy. It's solely geared towards this. And the idea of it is that we are putting pressure into the side of the muscle where there has been damage to that muscle. We target the opposite side to the site of the injury, and we cause what we call a bowstring effect. In other words, we're going to stretch by putting that pressure in. So if I just demonstrate with one hand first of all, if we imagine medial hamstrings have been damaged and there's an area that we've palpated, we've confirmed with the client that yeah, that's the tender spot, we know that that's where the fibres are torn. I'll move away from that and get to the opposite side, and I will just push my fingertips in from the side and release by coming back again. Once again, minimal oil so that you can get purchase on the skin because you don't want to be sliding over it. And if you can, depending on the length of the muscle, use both hands and both sets of fingertips and push in like so.
And we can do this anywhere on the body, not just the leg.
Anywhere at all. So as long as your anatomy is good, you know where the muscle is, where the origin and insertion is, direction of the fibres, and the site of the injury, and you've got all the information you need. The key thing about this one, we've talked about the variables all year, the frequency, rate, intensity, and duration. They play a much more important role with SSTM. By changing particularly the frequency and the intensity so you can move with the healing process. So this is something where we would be putting early forms of tensile loading into the tissue, pre-stretching, pre-isometric contraction, so very early repair phase. So typically we might start with light pressure and short duration of hold there. Light pressure, short duration. As you move, working with your client, presumably day by day as the healing process progresses, so you would start to put more pressure in and hold for longer, because you want to increase that loading, encourage the migration of the myofibroblasts to the area and the deposition of collagen aligned correctly with the rest of the muscle tissue. It's therefore got a fairly short window for use. It's going to be sort of early repair phase to, at the latest, mid-repair phase, because by then you're using the other techniques that we've mentioned, such as stretching, isometric contractions, and so on. If you find the limb rolls when you do this, then you may have to just steady with one hand, push in and release. And you'll see that I'm moving up and down the muscle because you don't want to keep compressing one area of tissue because that may become sore or inflamed. A latter stage technique where you can put more loading into the tissue, a bit like STR, you're going to use joint action, and now we can control this by putting fingertips in with a shortened muscle. There's a bigger bowstring there now, but as I lower that limb, I'm sure you can feel that, Jordan, and I can really feel the fibres pulling hard around my fingertips. Okay? So again, just recap, find the site of injury, talk to your client. They're obviously going to come in telling you they've pulled a muscle or something like that. So locate the tender spot where the site of injury is and just get your fingertips in the opposite side of that band of muscle tissue. Okay? Any questions on either of the techniques? No? Need a recap? Quick recap. So connective tissue massage, again, minimal oil on the skin, one hand laying on like so, other one adding pressure. Draw towards the middle, push down by extending your fingertips and pushing outwards. Draw towards the middle, push out. And keep working so you get a nice glow in the tissue. Should be really warm, make it much more pliable. Near side, use the thumbs, push in like so. And just keep working that tissue until you feel it becoming softer and more workable. SSTM, 2 hands if you can, just getting in the opposite side of the muscle, bowstring, hold and release. Move, bowstring, hold and release. And it doesn't matter where you are in the muscle, it's still going to provide the same amount of loading through the length of the muscle. And the fact that you're getting that sort of curved effect in the muscle is the same as basically taking the origin and insertion further apart. Okay. So what I'd like you to do is partner up, choose an area of the body, upper or lower body, I don't mind, and spend about 45 minutes giving them a good thorough massage, warming the tissue up. If you find some area that you can work on that's genuine, then fine. If not, you're just going to have to practice this. So if there's no sort of thickening that you can find of any fascia or whatever, then just practice for the sake of it. Okay? And Steve and I will come around and help if you need it.